You're at a doctor's visit. You walk into the front door and check in at the front desk. Then they ask you to kindly wait in the waiting room. Here, you wait for your family practical nurse to come through the front door and call your name. She comes through with her award-winning smile, as always, and asks you to come back. She brings you into the examination room, where she asks you to take off your shoes and any extra clothing, such as a sweater or jacket. Then, she'll have you stand on a scale so she can take your weight. After your weight, she'll have you stand against a wall so she can get your height. Then, she'll kindly ask you to put your shoes back on. Then, after that, she'll get ready to take your pulse, temperature, breathing, and blood pressure. After this, and she's done recording, she will leave you and go get the doctor. She will inform the doctor of any issues that you might have throughout her checking and any issues that you came for. Then, after your doctor's appointment, she may come back and give you any medication that you need. Practical nurses are supervised by registered nurses. According to Carrie Smith, a practical nurse from Minneapolis, Minnesota, her job includes taking vital signs such as breathing, pulse, blood pressure, and temperature, and administering medications and injections. She will also keep and record any information throughout your visit. Practical nursing comes from a rich history. It has many opportunities in colleges all over the world to help you make a living. First, I'll be sharing the history of practical nursing. Second, I'll be telling you how to get into it through many colleges. And finally, I will be sharing the benefits and salaries of practical nurses in Minnesota. According to the history of practical nurses at lpntraining.org, nobody is completely sure where practical nursing originated. However, Egyptians were the first to have inscriptions that contained detail of recording pulse, splits, and using bandages. The first training program, I might add, was in Brooklyn, New York, from the Young Women's Christian Association. Next, in Ballard, New York, was the first official school of training. Here, they learned to care for the sick and homemaking skills. During World War I, there was a shortage of nurses. This made the Army School of Nurses to be created to train more. Most practical nurses did not continue after the war, however. In the 1900s, the nursing career became more formal through licensing and education. The NAPN, National Association of Practical Nursing, was established in 1941 to give credit to these various programs. In college, you'll have to attend for 2 years. Here you will earn an Associate's of Science. Courses you may take include Human Bio, Composition 1, Lifespan, Medical Surgical Nursing 1 and 2, Practical Nursing Skills Lab, and Clinical Lab 1 and 2. According to the Career Discovery Encyclopedia and Licensed Practical Nurse pamphlet, Clinical Lab 1 and 2 gives you the opportunity to enter a living center and apply any information that you have learned on real patients. It will also teach you how to interact with patients. Although jobs may differ in the different benefits they give you, most are the same. Most will offer dental insurance, health insurance, workman's compensation in case you get hurt, paid vacation days in case you get sick, and most nurses work only 3 to 4 days a week. A practical nurse earns an average salary of $40,000. This, however, especially in Minnesota, depends on location, population, and your specialty in nursing. The career and everyday life of a practical nurse is based off a rich history. There are different ways to get into practical nursing that can be started at nearly every college. This can result in benefits and salaries in different areas around Minnesota.